Hertz probe. It does connect by the simple phone cord connection, okay? And there's also one here as well. So this cable can be replaced if there's an issue with it, just so you know between the two. On-off button is right here, okay? So if I press that, okay, your volume slide is on the side. Okay, so that's what creates the volume, okay? On this side here, that's your printer connection. This is for headphones, if you're gonna use headphones. Not in this procedure, normally usually do not do that. And then this little red button right there, that's the button we will use down when we're doing the waveforms to store the waveforms, okay? On the front of the unit.
How many waveforms can you store?
Well, it's 2 per, because you're gonna print right away.
Okay.
So it's meant to be, do the procedure, store, print, they're gone.
Got it.
Okay. So here you've got 2 buttons beyond a numeric keypad. Okay, so you've got sight, which is, you're gonna press that button and move from site to site, which we'll show you when we're doing the procedure. And then print is to print. So let me show you the sight right now. When we first turn the unit on, it always takes you to the right brachial artery, right? So that's where you go first. If I hit this again, it now tells me it wants to get a waveform. That's where we would come down here and do a waveform.
I'm just connecting to the right.
The next site would be the ankle. That's where we're going to do the pressure on the lower extremity. Then if I hit it again, it takes me to the other side and says, let's get a waveform first, then the ankle, and you finish with the brachial artery on the other side. So it's basically a horseshoe, okay? Start on one side, work your way down, and back up.
Okay.
Okay?
I'll see. Is there another connector, or am I supposed to take one of these out?
Is that?
I just opened this machine. So I'm
Oh,
not sure.
yeah.
There's one, right?
Yeah,
I guess I could pop that out too, but no. There you are.
yeah, you know, it's when we change cuffs.
Yeah.
I think it's the other way. I think that goes in there, yeah.
There we are.
Okay.
Good man.
So then the other component here would be your aneroid, right? So if you've done an ABI procedure manually, you've seen this before. If not, you're basically using the aneroid in the cuff to occlude, and instead of listening with the stethoscope, you're using a Doppler to listen to the blood flow be occluded. And then as
Dr. Maciel.
Dr. Maciel is doing this, he's going to watch the gauge for when the occlusion, as he pumps it up, when it gets occluded and there's no more flow, and then he's going to slowly bleed it out until flow comes back, and he's going to then enter that value on the numeric keypad.
So let's walk through this because I know it
Yeah.
stores stuff. I'll try to do it right. But basically, steps are, you want to locate the sound first, find the artery, the vessel, and that's going to tell you immediately what the tone is, right? Mono, tri, or high. So we'll illustrate that here first. Always handy to have your assistant with you because it's just better if it's a 2-man job. It's easier. So we're doing right brachial, right? So.
And did you have gel there? Yeah. And you can never use too much gel. Because the other way to, I'm sure you already know that in a lot of procedures you do, but gel is a doctor's best friend.
So remember it's all physics, right? Sound is coming at you. You want to hit it from a 45, otherwise you'll cancel the artery going that way. You're just gonna get a pulse reading, so always looking at the blood flow coming at you.
And one thing Dr. Maciel is doing that is helpful is once you find the flow, is finding a way to stabilize your hand, whether it be on the patient or whatever it is, because you want to keep it as you're occluding, right? As you pump it up. If you lose it, you're going to have to start over again.
So it's just a matter of moving. You don't want to push too hard. You don't have to. Triphasic. Can you zoom in? Can they hear it?
There we go.
Okay. Once you get that sound, try to lock where you're at. Start inflating. You want to go at least about 200 millimeters mercury because most people aren't ready to pressure that high, right? Once the sound is gone, okay, you release slowly about 2 to 3 millimeters of mercury per second until you hear that sound. Okay. 122. So that's why I first heard it. So 122 is my systolic on this arm. I would write that down, and it's gonna store it or not gonna store anything.
It will once you type in 122 on the unit right now,
Okay.
It'll store that for you.
Oh, I should have got the diastolic for the rest of it, but it's okay. So
No, that's all you need. That's all you need.
So what do I do now?
Type in 122 because
Okay.
that was so. It right now it's saying right brachial. You type in 122.
Okay, type it in, and then it stores it. It just went away.
Yeah, and then hit site. So what does it say now is site before
It says Ray wave.
Oh, so since you typed it took you right to the waveform. Now we're gonna come down here,
Okay.
and now we're gonna do a waveform. So no cuff. You're gonna bring
Oh,
your
got it. Okay.
you're gonna bring your blood pressure with you, but you don't need it yet.
Got it. Because it wants me to get the.
Yep. So now we're gonna get the waveform, which this is extremely
This is
important.
very good, guys. Very important. Yeah. Well, you can keep talking. Man.
Okay.
Tell them what to do.
So the blood pressure
didn't
cuff is
paint
just
your
here
toes.
for usage when it's time.
I
for blood
said you
pressure.
didn't
I don't know
paint
if
his
you want
toes.
to get angles better, perhaps. I
Yeah,
can
you want to
shit.
come over here.
And then so guys, gold standard, Stanford group, way to do this is to check both arteries, right? The dominant one is actually posterior tibialis in most patients, if I remember correctly, but that doesn't really matter. The point is to find the vessel that perfuses the most. That's gonna be the one that we will use for our measurement. So posterior tibialis is right behind the mal, usually no more than a centimeter. If you're gonna find it here.
And again, 45 degrees with the head pointing towards the knee is a way to think about it. Directionally.
That was monophasic. We'll call it monophasic. Yep. PT monophasic, right? So you would document that. And it's okay to do all vessels. Now, dorsalis pedis can be a little bit trickier. One of my blessed chief residents taught me that it's always nice to start at the web space between the first and second toes because that's where the branches go and they connect if you follow cephalad from that direction. So basically, put a little here, okay? That's one technique, and then you'll start there and just move it on up till you find it. There it is. Wait, might be by.
He had at one point it was so on here you can also here I'm gonna move so
Yeah, go ahead.
you can see the arrows so when you see them
Intervention.
going both ways
There's gonna be an intervention.
the arrow going this way is towards the probe, the arrow going that way is away, so when you get both you're getting a either mono or triphasic waveform. And I'll help you out with this one when it's time.
Of course, guide yourself with palpation of the artery if you need to. But that's what we did identify down here. It sounded mono to biphasic. Of course, Dominic's nervous now, so all his arteries are clamping. Now I really can't catch it. So we need 4 seconds of this, correct?
Yep.
And maybe he has a more dominant PT, and that's okay. So don't struggle too much. If you find a stronger sound on PT, go with DP. Or PT, sorry.
Yeah.
And that's venous. That is a venous sound. We'll talk about that later.
You can push down and it's supposed to include, right?
I just did. Venous. Just occluded it, as Dr. O said, right? Other little tricks for you guys. Anyway, back to the artery, so. Well, he got it there PT, so let's go with PT.
Yeah.
That's
It may
okay.
just be- okay. So
Let me give you the 4 seconds first.
there we go. So what you do when you've got 4 seconds in, there's a red button right here. Press the store button, and it tells you that waveform has now been stored. And now you're ready to do the ankle. So now what you can do is if you keep that same spot, and that's why we should have advised, which my mistake,
We're having
is
partner next to you.
connect this first because you're already on the site, right? So then once you find it with the waveform, it's the same site for that. So in a most efficient way to do it would be to pre-connect this. So then once you've already found the site,
I think you're in. Maybe push the white one. There you go. So again, cuff up to 200 probably is enough. Be careful not to move your probe is the most important thing probably.
Yeah.
That's what you want your attention on. Okay, 140 it's occluded. I'm releasing slowly. lost it. There it is. So 100. About 100, huh? See it?
Okay.
And you can always confirm by just pumping it again.
Okay.
Hold on.
Yep.
Again, go slow. 100. I just heard it.
Yeah.
Okay.
So 100.
So what you would then do is type in 100 because it's asking for the ankle. So I type in 1, 0, 0. Okay. And now it's asking for the waveform on the other side. So we're doing the horseshoe. But what I would do is pre-connect
Yes.
this first,
Yeah.
right? So that you have that. So now
Especially
we're-
if you're by yourself.
yeah, and now we're going to find the waveform first on this side. Then we'll do the
That's
ankle
the wave.
or the dorsalis pedis,
It's
and then we'll move up to here.
pretty nails.
It's fun being the patient, isn't it?
It's actually kind of relaxing.
So, and it correlates, right? So
I just
100
need
systolic should be a little lower
nice,
for the
yes,
foot.
relaxing
and then,
jazz
so we're
sound.
looking good. So it's probably going to be about a 1.1 or so if we're already thinking, which he probably doesn't have much atherosclerosis that we know of.
It's extremity over lower extremity over upper extremity, right?
That's what I used to do, yeah.
So it's
Upper, and then lowers.
100 over 122. That's about
Yes,
that's about
yeah.
0.8.
0.8, 0.9. Oh, did I do it backwards? Yeah, you're right. So yeah, calculate it. Let's see what it is. So now we're looking for a wave. So it's telling me look for a wave, right?
Yeah, 0.82.
Wait, but left
Down
is
has
it left
not
break?
moderate
What is
disease.
that? What is the
Waveform. So it's asking for the waveform first.
but for left break? Because I see a bra there. Does that mean
Fucking
I'm supposed to get it up there first or
I gotta
here?
take
No,
care of
it's
them.
your
Now
that's
I'm
the right side.
curious.
So left, right,
You guys wanna
right.
do
it's
me
Oh,
down,
it's
left.
saying what I
this?
already did.
It's already
Got it.
That's,
Okay.
that's your inventory list. Good,
Gotcha.
yeah, good question.
Gotcha.
Yep. So now we're trying to find the waveform.
So back to the posterior tibialis. That's why.
That's biphasic.
You might need an angel on your right side, bro. Oops, hip up. Don't say that. Just kidding.
All right.
So then you would press that red store button on the side, and you'll know it's stored when you see the STR show up on the screen. Done. Okay. So now you're gonna
triphasic. Yeah, nice. You're all right. He's just nervous.
now you can go ahead and inflate it, and
Or we're gonna let me just for illustration.
see
go
where you
ahead
get the best. Yeah, that makes
Yeah.
sense.
So start at the web space, crawl up slowly. I think he's just PT dominant, stronger on the over here.
I mean, try it over here. I feel like it's supposed to start.
Oh, let the clinical exam guide us.
That's vein.
It's both.
It's both.
Well, it's probably pushing on the vein. That's vein.
Yeah, that's vein.
There it is.
Biphasic.
Yeah. Anywho, yeah, I mean,
Alright, well,
don't
we got-
struggle, right? I mean,
Yeah.
if you got the easier one, go with the easier one. Try to get that number, but in general, go with this. I would say the stronger salvo form. And we did hear try on this one, so I would say triphasic at the left DP, mono to bi at the right. PT. I'm sorry, PT. Cool. So now we can pump the cup.
Yep.
Are you gonna Google this right now?
Google what?
His results?
I mean, you should know what they mean. You don't know what they mean?
All right. Cuff is going up. I'm focusing on the sound without moving.
Nice and strong.
Up to 140, I'll go to 160 just because I want to be extra sure. And we release 2 to 3 millimeters of mercury per second until you hear that sound. 130. 130 for the left PT.
Okay.
Cool?
So then type in 130 on the screen. And just let it go. And then now it's telling you the brachial. This will be your final reading for the patient. So you can see it's the horseshoe.
That's what you meant. So it
Yeah.
kind of walks you through
Yeah.
the recommended, suggested order, and I think
Yeah.
it's easier because it'll start recording things. So
Yes.
that's why it might be more convenient. And if I do the arms, it's gonna be like, uh-oh, what did
Well,
I
you're
do?
gonna have to jump around.
You have to jump
And
around
then-
and write
and
stuff
if
down.
If you don't follow the protocol it has on there, you're probably gonna accidentally
Yeah.
enter something somewhere you didn't mean to.
Got it. Okay. All right, so we'll do that first, Joe. And for the brachial, if you struggle to find it at the the groove, sometimes you can find it right under the muscle belly of the head of the biceps, which is about right here. In elderly patients, you just kind of go under there. It's a quick shot, but you always start right here. It's just, it'll be easier. If you don't find it, go for that
Can you use like a
biceps groove.
PP cuff to actually just get the measurements rather than which I know this is just use like press it, it'll give you pressure. Just do it on all four, then and then raise the weight
Beautiful.
The idea is the Doppler.
So again, bring it above 140.
Yeah, you could, but that's not considered ABI. Yeah.
Release 2 to 3 millimeters mercury per second. 118. Okay.
Was that 130, right? At
Yeah.
the bottom?
Yeah.
118 on this one. Okay. So then enter it. So then you enter 118.
Okay, and look what happens when you do that. Okay, so then wait for it to go. Okay, so,
Oh, it already calculated it.
yep.
1.06.
So if you hit that, that's one. If I hit the
Yeah.
sight button again, it'll show me the other one. So that's the right ABI.
It's still good.
Yeah.
You're right on the border, bro.
It's mild to
Stop smoking with your right hand. It's going over to the right side. Just kidding. Sorry. Don't take that advice medically. Stop smoking altogether.
Smoking cessation.
Smoke something else.
If you document every 30 to 90 days, how many, we should document smoking cessation.
Smoke all the other wound care companies.
Yes.
So when you're done, what you would do is you would plug this in now, this side up, okay? And we would hit the print button. And now it's going to print through. Now, one thing I think I may have made a mistake when I hit the site. I think I hit it one more time. I made a waveform that didn't exist.
Oh, it now gives you everything.
Yes, but let's see if your waveform came out okay.
Dude, that's
Wait,
cool.
it
Yeah,
gives
it
you the ABI on there?
Yep.
Oh,
Calculates it for you and
already.
everything.
Oh, that's actually kind of cool.
That is very cool.
Okay, so here's what you get. Okay, so you get your left and right ABI. Okay, and you get your two waveforms, and then what you can do is just cut it as it has here with scissors, and you can just tape it onto. And it's actually a peel and stick.
Yeah, they had skill and stick. I saw
Yeah.
that earlier.
So it takes a little skill to peel and stick. You know,
It's
I
just
mean,
water-based.
some people
You want
better
a
than
napkin?
others, right?
Napkin?
I'm terrible at unpeeling stickers.
It's fine, I got it.
That's where then you would put this.
Put the ABI right here.
No, it's water, it'll evaporate.
Yeah, exactly.
And then you're done. Well, fill out this part.
Yep.
And then this is what you submit.
Absolutely. So there it is, and this is all your data here. So the most important part of
That's
this
actually kind of cool.
It is cool.
is really the.
I didn't know they
think
did all
if
that together.
You pre-prep the patient. In other words, you put the 4 cuffs on. You follow the protocol of which way to go around, and knowing probably the most important thing you're gonna do. It's all very important, but really making sure you get quality readings for the waveforms, because if you don't, you don't know what they look like until you print.
Mm-hmm.
Now, if you're not sure, I mean, the problem is you've already started one reading, but I can always print, if I really want to check, I can always just go right to waveform.
Yeah.
If I feel like that patient's really giving me a hard time, and do a waveform real quick, store it and print it just to see how it looks, then start the procedure. That would be for maybe a really difficult patient. But now you're taking time.
No, you're right, and sometimes that's what we used to do is first identify the waveforms that whether you know the vessels are or aren't there,
Yeah.
and then go ahead and do the whole study. But I do notice it doesn't give you which vessel, right? Ankle. That's something that we would say. Like in this case, I use this
Yeah.
posterior tibialis.
You'd have to note
Just
it.
jot it on there, or just
you'd
in
have
your
to
note.
note it.
You're gonna write it
It's,
in your
it's,
note.
it's noted
Yeah.
on here,
Oh,
so
okay.
you can
yeah.
check it on
It's on there.
Yeah.
And then this correlates with what we heard, right? The right ankle was the mono, and you look at that waveform, you only see one hump.
Yeah.
Or over here, it's there's a 1, 2, 3 humps with reflective of a triphasic sound, or even bimono too. We'll talk about that more, but you can kind of make it out.
Yeah, I mean, it makes sense with the ABI.
It makes
reading.
sense. It correlates.
Because the
Yeah.
left side is normal and the right side is.
It correlates very well.
So with each unit, you're going to get a full operator's instruction, which this is good to have. This is more of a short cheat sheet, and if you have eyes like mine, you may need to blow it up.
Yeah.
But this will kind of walk
I
you through the
recommend
process as well. The other thing I would recommend is, I know Bianca sent out the email that had the link to the YouTube video. The only difference in the YouTube video is it's our model one down where it doesn't automatically store in here, so it shows them writing things down the whole time. You don't have to write anything down.
That's
You,
old-
can,
old
you,
school
get, you
way.
type it all into here. Okay, so that's the only difference between the two. The printing, the way you print is the same as far as getting the waveforms. But this one, you wait till the test is over until you hit print. Okay.
Got it.
Okay.
Cool.
And are these the machines were already purchased?
Yes.
Yes.
Okay. How did we get again?
Fresh